arthroscopic ultrasound investigation of hip joint, and ultrasound guidance of retrograde drilling of femoral head to treat osteochondritis dissecans lesion. Ultrasound imaging is based on the use of high-frequency acoustic waves. The ultrasound signal reflected from boundaries of two media or scattered within the medium are recorded to produce the ultrasound image. Arthroscopic ultrasound technique in the hip joint is based on the use of a sterile, flexible ultrasound catheter originally designed for intravascular imaging. The small ultrasound catheter is inserted into the joint during hip arthroscopy using conventional portals. The position of the ultrasound catheter can be controlled with an arthroscopic hook. An ultrasound catheter incorporates a rotating ultrasound transducer, which enables real-time ultrasound imaging in the plane perpendicular to the catheter. In addition to assessment of cartilage surfaces, the evaluation of cartilage inner structure and subchondral bone not accessible in conventional arthroscopy is possible with ultrasound imaging. This right hip was arthroscoped for intra-articular evaluation, femoral head OCD debridement, retrograde drilling, and autologous bone transplantation of the OCD. Anterolateral hip arthroscopy portals were used. Interportal capsulotomy was decised to enable free instrument moving intra-articularly. During the arthroscopic surgery, an ultrasound catheter was inserted into the hip joint using the anterior portal. The ultrasound probe was manoeuvred into the areas of interest under arthroscopic control with the help of an arthroscopic hook probe. The severity and extent of the OCD lesion could be evaluated using ultrasound imaging. The irregular cartilage surface and abnormal subchondral bone were clearly visible in ultrasound images. The ultrasound measurement of lesion depth was in line with that measured from MRI. In addition, the calcified layer within the OCD lesion was clearly visible in ultrasound image and no fluid was detected beneath the cartilage layer. Based on the ultrasound, hook probe and arthroscopic investigation, the OCD lesion was graded to be ICRS OCD grade 2. Quantitative analysis of the ultrasound signal showed a decrease in the surface reflection and an increase in surface roughness and backscattering for the OCD lesion as compared with the intact cartilage in the acetabulum. The ultrasound reflection and roughness parameters are related to the integrity of cartilage surface layer, whereas the backscattering parameter reflects the integrity of cartilage inner structures. Based on the anamnesis, MRI and arthroscopic findings, retrograde drilling and autologous bone transplantation was conducted for the patient. Ultrasound guidance of retrograde drilling was possible. The drill can be seen in the right-hand side of the ultrasound image. Ultrasound provided real-time information on the location of the drill beneath the cartilage surface and thus enhanced the control of the subchondral drilling. The ultrasound arthroscopy technique may give new possibilities for precise diagnostics and treatment in hip cartilage lesions. Further patient series are needed to confirm the applicability of this promising technique.